Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home-related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar is Insights in Long-Term Care Quality Staffing and more. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is Infection Control Escape Room with Pennsylvania Project First Line. If you're interested in joining, that will be the same time and place next Wednesday at 2 p.m. Today's webinar is a bit different than our usual format. We will be listening to an episode of our podcast, Taking Healthcare by Storm, where Quality Insights Medical Director Dr. Jean Storm interviews experts in the healthcare industry. In this episode, Dr. Storm interviews Nancy Zionts, who is the Chief Operating Officer and Chief Program Officer of the Jewish Healthcare Foundation. After listening to the interview, we will have a Q&A. Dr. Storm is here to take questions from our audience. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. Now, before I start playing, Deborah Wright, our Quality Improvement Specialist here, wanted to say something real quick before we hit play on this podcast.
Thanks, Kathy. So what I'm about to say is mainly directed towards our West Virginia partners who are on the call. While the call today, as well as the call next week, are specifically driven towards Pennsylvania programming, we are looking to institute the Project First Line escape rooms, do our own kind of escape room for West Virginia. And we're also looking, I've been talking with Pam Metter, which a lot of you in West Virginia, you know who Pam is. We are looking to see what we can do for this teaching nursing home collaborative that is currently going on in Pennsylvania, and how we can start something like that in West Virginia. So while both of these calls this week and next week are Pennsylvania driven, we want to hear from our Pennsylvania participants if this is something that you are interested in getting started in your state. If you are, please feel free to reach out to me. Pam and I are going to be working real closely, especially once the new year starts. So we do want to make sure that you're aware that even though it's not available to you right now, it is something that we are looking to start after the first of the year. So I hope you stay on today's call, still join us next week, hear what's happening in Pennsylvania, because we would like to do it in West Virginia if it's something that you would like to see happen as well. So thank you, Kathy.
Thank you, Deb. And now I will hit play on the podcast episode, and we'll see you once the episode is over.
Hello, everyone, and welcome to Taking Healthcare by Storm. I am Dr. Jean Storm, Medical Director of Quality Insights, and today I am so excited to have Nancy Zionts with us. Nancy is the Chief Operating Officer and Chief Program Officer for the Jewish Healthcare Foundation, where she leads important initiatives focused on quality and safety in healthcare, particularly in aging, long-term care, and women's health. With extensive experience in improving healthcare systems, she spearheads the Pennsylvania Teaching Nursing Home Collaborative, which we are basically going to be focusing on today, along with other topics. And this collaborative strengthens partnerships between nursing schools and long-term care facilities to enhance education and care quality. It is so innovative and important and needed in the long-term care space. Nancy has also played a pivotal role in various statewide initiatives, including those addressing the challenges posed by the COVID-19 pandemic. And we are still, I will argue, really facing those challenges today, especially in long-term care. We are looking forward to hearing her insights on transforming nursing education and improving care for older adults. Welcome, Nancy. Thank you so much for being with us today.
It's a pleasure. Thank you for asking me to be here today.
Great. So let's just jump right in. Tell us how you came to do what you do.
So I have been in the field of healthcare and in the field of aging for the 40 years of my career. I literally just on September 17th hit the 40-year mark of working in the aging field. And I got into this work because I'm passionate about older adults, seniors, elders. I'm not as passionate about what the word is, but I'm very passionate about the people. And the first job I got when I moved to this country from Canada was with a health system that had a long-term care facility. And I got started in that work, and it hasn't stopped. I've been at the Jewish Healthcare Foundation for 30 years, in charge of their aging agenda as well as their women's health agenda. And on most days, I don't tell those two things apart. So
That's good. We don't want silos. I think breaking down silos is important. So workforce challenges are significant, a significant concern in healthcare. How does the Jewish Healthcare Foundation attempt to address these challenges, particularly in the long-term care setting where they're just so pervasive and difficult?
well, thank you. The Jewish Healthcare Foundation is, we do our work on behalf of, with, and for the populations we are trying to serve. But we have recognized long ago that we're not in the direct service business, that if we are going to make an impact, and if we're going to help the end user, the end recipient of healthcare, I hate to say it in a very crass way, but it's the workforce, stupid. And we've been very focused on workforce issues for at least the last 25 of the 34 years of the foundation. In fact, we have a sub-organization of the Jewish Healthcare Foundation called Health Careers Futures, and it is focused on the supply and demand and training and upskilling and support and advocacy for workforce across the board. So we've done a lot of work with midwives and doulas in the last 5 or 8 years, a lot of work with community health workers. We run a behavioral health fellowship to try to ensure that we can help produce the right workforce for the behavioral health industry. And we have been in long-term care workforce for at least the past 25 years, in addition to a focus on nurses and doctors and pharmacists, et cetera. It doesn't matter to us what category of worker it is. It doesn't matter to us what setting. It matters that we figure out a way to support and educate, train, and advocate for a strong workforce that's well supported.
Yeah, and I would argue all those different types of individuals working in healthcare are just essential in reducing health inequity, addressing those social determinants of health. So
Absolutely.
I think,
From
yeah.
social
So
workers to pharmacists to therapists to ethicists, they're all important.
yes, absolutely. So leading the COVID-19 learning networks, I'm sure presented unique challenges. What key lessons did you take away from this experience, and how do you see these lessons shaping future responses to public health crises?
So we came out of the COVID-19 pandemic, and I so believe what you said at the beginning in the introduction. We're not out of it in long-term care. There are other sectors that have decided that COVID is gone, but I speak to nursing homes every day, including today, where they have outbreaks and where they are concerned for their workforce, they're concerned for their residents, they're concerned for their families. So the COVID-19 outbreaks are not completed, and they probably never will be. They'll just be a new chronic disease or chronic condition that we're looking at year after year. But we went into the COVID-19 pandemic with a lesson learned, and that was, and we did a documentary on this, what COVID-19 exposed in long-term care. Long-term care did not do poorly with COVID-19 because of anything long-term care had done wrong. In fact, it was 20, 30 years of neglect of the long-term care sector that set it up for such a significant fall during the COVID-19 pandemic. So it exposed the lack of attention that had been paid up until now to investing in things like infection control, investing in things like making sure there were the appropriate supplies, or there was an appropriate workforce that was appropriately trained, supported, and valued. So COVID-19 just exposed those issues. And our commitment now is the same as it was before, and that's doubling down. It's doubling down on what do we need in order to keep our residents safe in long-term care, but very importantly, what do we need in order to support our workforce so that they can deliver the best care possible and receive the best, not just recognition and respect, but also compensation and support for the work that they're doing. How do we strike a better balance between what resources go into the acute sector and what go into the long-term care sector, because they are symbiotic, and we have to make sure that we are paying attention to all sides of that equation.
I agree with you 100%. And I think the lessons most definitely are we need to really focus on our infection control, infection prevention practices, and support our workforce. I mean, 100%. So you received the 2020 Kelly Pruitt Age Friendly Leadership Award from the Southwestern PA Partnership for Aging. Can you share what this recognition means to you personally and how it reflects your commitment to improving care for older adults?
So I don't do this for the awards, and they're nice. The recognition is lovely, but every now and again you get recognition in the name of people, and this is Mary Ann Kelly and Charlie Pruitt, that I knew personally, respected tremendously, considered both to be mentors of mine for the 40 years of my career for Charlie and about 30 years for Mary Ann Kelly. And they really provided me with a network, with support. We learned a lot together. We advocated together. We struggled together with some of the problems in long-term care and aging in general, not just in long-term care. And so to receive an award with their name on it meant a tremendous amount to me. It helps you to realize that this work is only done in partnership. On my first day of work on September 17th, 1984, I was told by my then boss, you're going to be working in aging. We're going to take you to go meet Charlie Pruitt. And I went to meet Charlie Pruitt. And Charlie said to me something that stuck with me. And that was, you're going to be working in the field of aging. There's never going to be enough money to do everything you need to do. Work with others, partner, collaborate, and network. That's the best way we're going to get things done on behalf of older adults. That has been a calling for all of us who've worked. Charlie trained and mentored so many of us. And Mary Ann was a policy and advocacy genius, and it was a pleasure and privilege to work with them. So I have that award over my shoulder in my office because it provides me with ongoing inspiration.
That's fantastic in getting inspiration. I mean, it just amazing. So I was recently lucky enough to hear a session during the Voice, which is the Voice of Inspired Change for Elders, the Voice PA, their annual Accord conference. I was able to hear a session before my session that I did on the Pennsylvania Teaching Nursing Home Collaborative. And I was just blown away. And I've heard of this collaborative, but just hearing it again, I really wanted, that was why I wanted to bring you on to talk about this collaborative. So can you elaborate on the primary goals of the Pennsylvania Teaching Nursing Home Collaborative and how it aims to strengthen academic practice partnerships between nursing homes and schools of nursing?
Sure. So this was something that came out of the COVID-19 pandemic as we were sitting on the sidelines, trying to be useful, trying to figure out what was the most important thing we could do to show our support for those who were working in long-term care and the residents that they were taking care of. We got together with a colleague of ours, the John A. Hartford Foundation, which is a national foundation out of New York. They had funded the original teaching nursing home project in the 1980s, which matched up primarily nursing schools and medical schools with long-term care facilities. And they wanted to revive that. They wanted to revive that initiative, this idea that if we could bring additional resources from academia to long-term care, and we could help create a sense of ongoing searching for better options and ongoing research within nursing homes, we could make a difference for the workforce and then ultimately for the residents. So we decided to come together and do a pilot project in Pennsylvania. And we contracted with 3 schools of nursing in Pennsylvania. It was Pitt, Penn State, and University of Penn. Together with 4 nursing homes in Pennsylvania. We partnered them up together. So we did the west, the central, and the eastern part of the state. And the idea was, could we develop tools and opportunities that would improve academic practice partnerships and introduce a framework for quality improvement, that framework being age-friendly health systems? And could we do that while trying to track, and this was one of my key jobs during the first part of the initiative, trying to cracked some of the key policy or advocacy levers that also needed to be looked at if we were going to make sustainable change. We weren't far into the pilot project, which was 2021 to 2023, when the John A. Hartford Foundation said, you know, this is really important. Let's see whether or not we can do a deep dive and do a phase 2 to disseminate this across Pennsylvania and invite in other states to watch the deep dive dissemination so that they could be next in line to do this as well. So the 3 components are improving the partnerships between a school of nursing and a nursing home, and then also implementing age-friendly health systems for nursing homes specifically. And when we started this in 2021, the age-friendly health systems for nursing homes was brand new. In fact, the model was very focused on primary care and hospitals and didn't work for long-term care. But by the end of 2021, there was a new guide and there had been some tests done on what a curriculum specific to long-term care could look like using the 4 M's, which are what matters: medication, mentation, and mobility. And so that was able to be implemented in the pilot project and now in phase 2 in the dissemination project. But what was really important to all of us was identifying the fact that we had leaders in the long-term care sector and leaders in the school of nursing sector that often felt completely disconnected from each other and often felt that long-term care was looked at as a stepchild of the healthcare system and wasn't given the same respect for schools of nursing, so that you often didn't get a practicum in a nursing home at all. And in fact, if you didn't have a champion or leader in your school of nursing that really was passionate about long-term care, you often weren't even offered a long-term care placement. And if you were, it was, well, we're sorry, all the ICU placements are taken, so you'll have to do long-term care, as if it was a punishment. And we wanted to really change that paradigm. We wanted to reinvigorate geriatrics in schools of nursing across Pennsylvania and across the country. And we have been so thrilled with how the energy has grown within our schools of nursing. That was my biggest surprise out of phase.
That's just wonderful to hear. Makes me very happy. So can you share insights learned from the initiative? What specific outcomes have emerged from the enhanced partnerships between academic nursing schools and nursing homes?
So the insights and the outcomes are different. The insights are, it's not a radical insight, but it's really important. Champions and leaders matter. So when you can identify a faculty person or a dean or even some professors that will champion geriatrics and champion long-term care within their school of nursing, you are halfway there. And if you can't, it's a really heavy lift to get your school of nursing to want to participate. But if you do have that champion or that leader who is proud, not afraid, but proud to stand up and say, they started their career as a CNA, or they have a real passion for geriatrics, and they have not had a placement, but they'd like to work to develop one, that became something that was, really an aha moment for us. The second aha moment for me came when I went to the PADANA conference. That's the Pennsylvania Association of Directors of Nursing Administration. And I went to their statewide conference a few years ago. They are partnering with us on this project, and they invited us to present. And I know the old Carrie Mason adage, you shouldn't ask a question you don't know the answer to. And there I was at the podium asking a question I thought I knew the answer to, and I got an answer I wasn't expecting. So the question I asked was, how many of you, it's a room full of nursing home administrators, how many of you have a relationship with your school of nursing? And I had thought I would see a small smattering of hands. What I saw instead was every hand go up. So then I thought, well, that wasn't what I was expecting. Now I'm going to ask the follow-up question. And what was the follow-up question? How many of you are satisfied with that relationship with your school of nursing? And that's where I had a smattering of hands staying up and most of them going. So that became our challenge. How do we create an environment where those relationships are better? What's missing from those relationships? And what we found out when we spoke to the nursing homes in particular was that They accepted anybody who came into their nursing home that wanted to be placed there, and any school of nursing that made an overture to them to place a student. But other than that, they felt they had no power, if that's too strong a word. They had no power in that relationship. So they didn't feel they could ask anything of the School of Nursing. For example, stop sending us students in their first semester that haven't had any exposure whatsoever to body mechanics or to principles of nursing, et cetera, because they could do harm in the long-term care setting. Make sure that before students come into a long-term care setting, they've had some exposure to common conditions for persons living in a nursing home. Dementia being one of those that is at the top of the list, but so is multiple chronic conditions or polypharmacy. So it became a question of how could we help the schools of nursing and nursing homes in a more collaborative way understand what was important for a student to know before they came in and what it was important for a student to know as they were there in their placement. So that was the first thing that I think took down the curtain in between the two of them and got the nursing homes and the schools of nursing collaborating. And that has been very exciting to see that there have been now protocols, and not in a punitive way, but in a very collaborative way. What should a good placement look like? When should it happen in the nursing students' curriculum? When should it happen in their trajectory of their career? And also, there were nursing home staff and leadership that were prepared to serve as visiting faculty, adjunct faculty, guest lecturers at the School of Nursing. So you weren't asking the School of Nursing to learn all of the distinctions with long-term care themselves, but you were inviting them in to share that with the faculty of the School of Nursing. That was incredibly popular, and those relationships became very positive. What's the role of the medical director? Having medical directors interact with schools of nursing, having medical directors interact with students from the School of Nursing when they were there for their placement. So all of those things help to enhance the academic practice partnership. But the second thing that happened that was really important was that integration with the age-friendly health system methodology. So age-friendly health system was created by the Institute for Healthcare Improvement together with the American Hospital Association and the Catholic Healthcare Association that are helping to implement this model of age-friendly health systems. And what they were able to find out is it's a really good framework for organizing student learning and workforce learning, as well as implementation of a quality improvement strategy within nursing homes. And what became really valuable for the students to do when they came to a nursing home is maybe they weren't ready to change wounds on day one. Maybe they weren't ready to pass meds with LPNs on day one. But where they could engage that was making a difference in the lives of residents and in the lives of the students and in their understanding of why choose long-term care and why commit to geriatrics, the students were engaged in a portion of age-friendly health system called What Matters. And so many of the students were engaged in interviews with the resident. They got to sit down one-on-one or two-on-one, so it was usually two students and one resident together to have a conversation with a resident about what mattered to them, because it would help to break down some of those stereotypes and some of those images that people had of what it was really like to talk to a senior. For so many of the students, this was a wonderful, wonderful experience. It connected them to the residents. It in many ways inspired them to want to go into this field. And that to us was some of the greatest work that was done by implementing the 4 M's as part of this work.
I just am so very impressed with this initiative, I will say, just for so many different reasons. So you touched briefly on the age-friendly health systems 4 M's framework and how crucial a role it played. So how do you see the implementation of the 4 M's improving the quality of care in nursing homes?
So the framework is so simple as to make people skeptical about the fact that it could really move the needle on quality. And to be fair, we all know, and I know I'm certainly preaching to the choir here, the number of regulations and the number of incentive programs or quality initiatives that nursing homes have been exposed to it would be fair for people to cynically say this is like the flavor of the month. So is this one going to stick around, and do I really change how I organize my quality work? But when they got down to it, in addition to having the what matters as the first thing, so if you're talking to Mrs. Jones and you find out that what matters to her is she always liked to stand up at the mirror and do her own face washing or putting on makeup or whatever it is, but she liked to do that herself. That mattered to her. That was, for her, it was dignity. It was retaining her independence. So then you start to think, okay, how does that, now I have it for one of the M's of what matters, but now how does that relate to something else that she's doing? So now I have to look at the other ones. And in that case, it was around her mobility. How do we get her to the sink? How do we get her to be able to either stand up, or if not possible, to sit by the sink, to have her supplies in a way that she could reach them so she could do that by herself? That became part of her mobility plan. So instead of the mobility plan being she's going to walk up and down the hall 3 times a day for those steps, it was more about her stamina to be able to stand in her bathroom at her mirror for 5 minutes. So what is the mobility plan? What is the therapy plan to allow that to happen? So that became a specific tie into the 4Ms. Deprescribing is a huge issue under medication management. One of the things that we did learn in COVID is people have medication regimes that we stick to for years and years. We don't question them when things get added, when things get changed. And during COVID, when we were trying to reduce the number of times that we passed meds to reduce the number of exposures and the number of times that staff had to wash their hands, we in those days got very creative about looking at the med plan and saying, you know what, we could change either the order or the grouping of these meds to have this one not maybe every day, but maybe it's now every second day, and we saw the same results. That got people thinking about new plans for deprescribing and medication management, a very core piece of the medication M in the 4Ms. Mentation was another one. How do we engage? How do we look at the behavioral health issues that are facing so many of our residents? And then there were some key quality indicators around the prescribing of antipsychotic medications or engagement with persons with some anger management issues that needed to be addressed. All of those things and obviously, how do we work with persons living with dementia, making their lives fuller, safer, etc. So the 4Ms really do capture a lot of the day-to-day core issues of the people that we are all looking to serve as residents in nursing.
Yeah, and what you've described is person-centered care.
Absolutely. It's person-centered care, right? What matters is nothing more than person-centered care. And then you cascade it down to all of those other areas. So we can say person-centered care until the cows come home. But how do you put that into a plan that makes sense to the frontline workers? And it is everybody's job. It is not one person's job. Everybody is involved in age-friendly care and person-centered.
Absolutely. So you talked a lot about how you are exposing nursing students to long-term care careers, how thoughtfully that is done. What feedback have you received from some of the participants?
So I am a woman of a certain age. Will never see me doing a TikTok. But I love receiving from some of our nursing home partners the TikToks from their students who talk to other students about just how satisfying their time has been in nursing care. They have become the people who are promoting long-term care to their colleagues and fellow nursing students. They talk about the experiences that they had for the day. They talk about how that relates and has changed their view of working with seniors. They also talk about something that we don't talk about a lot when we look at, because we don't often look at the difference between long-term care and acute care. But if you are a new nurse in acute care, you are at the bottom rung of a ladder that is very tall and very wide. And the opportunities for you to get involved in a leadership role takes a long time in an acute care setting. In a nursing home, it's a much flatter organization. It's much more team-based. And so the opportunities for some of the younger, newer students to come into a long-term care facility and get involved in a small team in a project where they can bring their, maybe it's up-to-date tech skills, maybe it's ways for them to discuss and relate with others. Their ability to do that sooner in a long-term care setting has been very inspiring to them. So it's a great way. We have a partnership with the University of Pittsburgh Graduate School of Public Health that is doing the evaluation, and they have developed QR codes where the students can, after every interaction within a nursing home, the day placements, the week time placements, et cetera, they're able to grade and give feedback on their experiences in nursing homes, which we can then use not just to prove that the intervention is making an impact, but also for us to identify opportunities where it could make a greater impact in other nursing homes as well, or other schools of nursing.
Yeah, and I love to hear about social media working as a force of good. That's great about
yes,
TikTok.
exactly.
So the collaborative offers a variety of resources and learning sessions. Can you share a success story around their implementation?
Well, we've developed, firstly, what I want all of your listeners to know is these resources were developed with a lot of generosity by the John A. Hartford Foundation, the Jewish Healthcare Foundation. In phase one, we also had the Henry Hillman Foundation, and we've had the Independence Foundation. And we've had partnerships that have enabled us to produce resources that are free to all the long-term care facilities. I could say that again and again. So we're developing guides, implementation guides, how to get started. We have monthly meetings where people who are already involved and who are ahead of anyone who hasn't started yet are coming together to tell their stories and to say, here's how we got started. We're in a rural area, so we do it a little bit differently because our nursing home only comes in, for argument's sake, once a quarter. Or we're in a city area. We have 4 or 5 nursing homes here, so we're accommodating them all at the same time. You can hear directly from the people who are doing this work. And once a month, we also have office hours where we have people who are coming together to ask each other questions. Now, we had our largest office hours this past month. We're seeing a growth in people who want to get involved in this teaching nursing home work, and we want them to get involved. So they're coming together. The best resources we have are the people who are doing this and have already done this and are happy to share what they're doing. But we've developed tapes. We have all sorts of videotapes and written stories of how this is being implemented. And we are connecting people on an ongoing basis to the pioneers, the ones who did this first, who are not afraid to say, you know what, we were too ambitious at the beginning. And then we decided if we pared it down and listened to our staff and went in this direction, we could be more successful. Everybody wants to know. It's great to see the success story, but that doesn't necessarily make something approachable for people to figure out how to get started themselves. So we've created a number of mechanisms for people to hear from the others who have gone before them and who are just maybe 1 or 2 steps ahead of them and are prepared to share with what worked and what didn't work. And those things are all incredibly valuable. The last resource that was developed, and this is the only thing that costs money because it was done by a publisher, there is a brand new first ever textbook for frontline workers in long-term care. Textbook is called Practice and Leadership in Nursing Homes, and it is building academic practice partnerships. And the textbook is available, and it was co-authored by 40 of us who've been involved in this work over the past few years. We get nothing for it, any of us, but this textbook has been, we think, really very valuable for some of the schools of nursing and some of the nursing homes to be able to understand the stories and what goes into this work.
Oh, absolutely. You touched a little bit on the dissemination phase and its impact on local and national levels, so other states. How do you envision the future of academic practice partnerships in long-term care evolving?
So I would like to say that our ambition in phase 2, it's one of our goals, is that every single nursing home in Pennsylvania is involved in the Teaching Nursing Home Collaborative. That is a large, hairy, audacious goal. But I have been so pleasantly surprised with the number of nursing homes that have come on board already. We're far greater than halfway to that goal within Pennsylvania. And once the nursing homes are ready and have the mindset and have the tools and are ready to go, each one of the schools of nursing could partner with upwards of 10 nursing homes, because there are 600 nursing homes in Pennsylvania, over 600 nursing homes in Pennsylvania. That is a huge hill to climb. I will say that this is a personal belief. Not every single nursing home, we want every single nursing home exposed to age-friendly health systems. I'm not 100% sure how your listeners feel, but I don't know that 100% of the nursing homes would make good teaching sites. But 100% of those that would make good teaching sites should be good teaching sites. And they should have access to the resources, and they should be bringing in students. Some of them are doing full classes. Some of them are doing just one or two who are doing graduate level projects. But that to me is part of our goal. And we have invited in other states where we can't work as closely with them on the matching like we can do in Pennsylvania. We have a matching map in Pennsylvania, but we can share all these resources with other states. And I know that Quality Insights is more than one state. We're looking for leadership in other states that wants to say, we'll be the lead, give us the resources, we'll take the lead on reaching out to the nursing homes and schools of nursing in our state. And we can have those states side by side with us in our quarterly state and national advisory meetings, getting the information, learning, and taking the lead in their states. And they would be most welcome.
I will say my wheels are turning now.
We also are, our ultimate dissemination goal is across the country. So sitting at the table with us since day one have been wonderful representatives from CMS, from HRSA. At the state level, we've had people from Department of Health, Department of Human Services, Leading Age, other of the associations that have been sitting at the table with us, ready, willing, and able to grab this and take it and run with it. And that's our ultimate goal, getting us out of this business, pushing it out into the field, and then having some CMS and HRSA changes that enable these partnerships to take place and incentivize them to take place across the country.
Yes. So last question. Looking ahead, what are the biggest opportunities and challenges you foresee in healthcare quality improvement, particularly in aging, long-term care? And how is the Jewish Healthcare Foundation positioned to address them?
So I think the best opportunity we have is to build our workforce. I'm really proud that just 2 weeks ago, we were awarded an Appalachian Regional Commission grant to work with nursing home partners within Pennsylvania. They're already named, they're already selected, as well as SCIUPA, to help train and hire and upskill CNAs for long-term care. We have to fix the supply and demand issue. We have to fix this training issue. It's the mission of, as I said, Health Careers Futures at the beginning, but I think that the biggest challenge is going to be the adequacy of our workforce in terms of numbers and the support that workforce gets in terms of their compensation, in terms of perhaps a better understanding of how the regulations do and don't facilitate good quality care. And so I think that's one of those areas that we are very focused on in terms of opportunities. In terms of challenges, you said it early on, and I just want to reiterate, the day-to-day work in skilled nursing facilities is hard work. It is hard work person by person, but it is really hard work right now in an industry that is under siege financially, under siege for regulation, and it is facing some existential crises relative to workforce. So, and frankly, as we said twice during this podcast already, COVID is still there. And if it isn't COVID, it could be pneumonia. And if it isn't pneumonia, it could be the flu, and so on and so forth. So we really have to meet our nursing home partners where they are. If we are fortunate enough not to be in that very hassled and harried environment every day, we have to at least recognize that our partners are, and make sure that what we do contributes to reducing their stress and improving their productivity and their ability to have positive outcomes, and doesn't just become one more straw to break the camel's back. That's certainly not our goal.
Nancy, thank you so much for joining us today. I am just continually, I was blown away over the last 40 minutes from the good work that the Jewish Healthcare Foundation is doing. You can hear the passion in your voice, and I am so excited to hear about everything that the foundation has accomplished in the future. And I would love to get you on again to talk
I
about
would love
that.
to come. You know, we've had a wonderful relationship with Quality Insights also for over a decade. And anything that we can do to help our providers in the field is something that's going to help our residents in the field, the older adults that and others living in nursing homes that we're trying to take care of. So these partnerships are so important, and we're so grateful to the people who do the work every day. So thank you.
Yes. So we will link any information if anyone is interested in learning more about the Jewish Healthcare Foundation or the Pennsylvania Teaching Nursing Home Collaborative. We will link
Please
those.
link to patnhc.org. And the best way to get a hold of us is to fill out a Join Us form. And once you have filled out a Join Us form, you will be in our family, and we will be happy to share anything that you want or need from us. Thank you.
Yes, I encourage all our listeners in the long-term care space, join the family. Nancy Zionts, thank you so much for joining us today.
My pleasure. Thank you. Have a good day.
All right, that is the end of that interview that Dr. Storm did with Nancy Zionts. In a moment, we'll begin the Q&A portion of this webinar. Dr. Storm is here to answer any questions. Unfortunately, Nancy couldn't join us today. If you have a question or comment, please, about the podcast or about resident engagement, please submit them using either the chat or the Q&A tool in your Zoom menu. You can also raise your hand to request to be unmuted to ask your question out loud. Before we continue, I'd like to draw your attention to the chat. I put some links in there that were mentioned. There is a flyer for the Pennsylvania Long-Term Care Learning Network's webinar, which is tomorrow at 2 p.m. That's their quarterly learning collaborative, and a couple of our staff from Quality Insights will be there to talk. And I also put in the link to the Teaching Nursing Home Collaborative. And finally, I put in a link to the Taking Healthcare by Storm podcast webpage if you'd like to listen to more interviews. Before we start the Q&A, I'd again like to invite everyone to next week's webinar, which is on Pennsylvania Project First Line's Infection Control Escape Room. That will be the same time and place next Wednesday at 2 p.m. You can find the links to our webinars in the newsletter we send out every Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on our mailing list, you can email me at caudill@qualityinsights.org, and I will get you on that list. And I don't see any questions in here so far. Dr. Storm or Deb, do you have anything you'd like to add before we wrap up today?
I would just like to echo what Deb said earlier. I mean, it's just a fantastic opportunity, and to bring it to West Virginia, I think, would be a fantastic idea. So, hopefully more to come.
All right, thank you, Dr. Storm. And I think I can go ahead and wrap us up for today. Let's see, since it doesn't look like there's any questions. Before we sign off, I'd like to ask everyone here to please answer a short evaluation of today's webinar. It's anonymous and will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Dr. Storm, I'd like to thank you for joining us today to answer questions. And I'd like to thank our attendees for joining us today, and we hope to see you again soon.